eye puffiness due to insomnia for 7 years? Hi, I've had lower eye puffiness for the last 8 years. I think it's due to my insomnia. I've been sleeping more for the last 2 months, regular sleeping schedule and at least 7 hours of sleep. Will my puffiness go away, or will I need lower eyelid surgery? I'm 31 now, and my bag's insomnia started at 23 years of age.
Thank you for your question. You have had insomnia for a long time, and I understand you're sleeping more recently, and this process of these puffy bags started when you were 23 years old, and now you're into your 30s, and you're asking whether or not the puffiness will go away or whether or not you'll need eyelid surgery. Well, in order to understand what this puffiness is, it is to appreciate how much it is present during your normal waking hours, and how much is it present whether you get a lot of sleep or no sleep or very little sleep. Most of the time when people come to us, they'll say that no matter how much sleep I get, these bags won't go away. And everyone asks them if they're getting enough sleep. So it's natural to assume that it's related to the insomnia. What these puffy bags most likely represent, based on the photos you submitted, is something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that fat that's normally around the eye pushes forward and creates a bulge, such that the eyes are always looking puffy. So most likely it is something that you will need some kind of surgical procedure. Now, when it comes to eyelid surgery, there are two approaches to the puffy bags under the eyes. One is called a transcutaneous, or through an incision on the outside, and the other is called a transconjunctival, or through the inside of the eyelid, known as transconjunctival blepharoplasty. Based on your age and the photos you submitted, most likely that's what I would recommend. In my practice, I do a lot of eyelid surgery, and a lot of younger people like yourself who have bags under the eyes really appreciate when I do this procedure from the inside of the eyelid. This way, when people see you, they have no idea that you had eyelid surgery. And if I had to choose one procedure that has such a dramatic impact on facial appearance, it has to be the reduction of lower eyelid bags. It literally opens up people's faces, their eyes. It's almost like having a facelift for so many patients. So what I would advise is, of course, do some research, meet with a qualified cosmetic surgeon. My bias is that you go to a surgeon who does a lot of eyelid surgery, look at the doctor's before and after results, and be confident about the style so that you feel like you resonate with the doctor. In our practice, we actually do this procedure under local anesthesia with light IV sedation. Again, our patients appreciate that because they're not put under general anesthesia. They don't go into a hospital. We have our own Joint Commission approved facilities, so the level of safety is at the highest level. And at the same time, they get just enough sedation so they don't remember anything, and they're very comfortable, and they're able to recover quickly. Typically, our eyelid surgery patients for lower eyelid bags go back to work in a week or even less, and with very little bruising or swelling. So again, now it's a good time to then learn more about your options, do some consultations, and choose the right doctor to help you with your procedure. So I hope that was helpful, and thank you for your question.